You may be into punk rock, soft rock, or classic rock, R&B, hip-hop, or house, country, techno, or techno-country. But no matter what kind of music you listen to, here's something else you should hear. Please consider getting vaccinated. Talk to your pharmacist today about Comirnaty, COVID-19 vaccine mRNA. This message brought to you by BioNTech and Pfizer.
You're listening to Talk with Audrey.
Janine Maxson was in her late 30s, living the life of work hard, play hard, nonprofit executive in Washington, D.C. However, her migraine headaches, which she'd suffered from since the age of 6, were becoming increasingly debilitating. A subsequent MRI revealed a Lyme-sized tumor in her brain, which would ultimately be diagnosed as glioblastoma, a rare and aggressive form of cancer, but the most common type of primary brain cancer in adults. Janine and her physician, Dr. Karen Fink, a neuro-oncologist at Baylor University Medical Center in Dallas, joined me today to help raise awareness of GBM and the latest treatments and technology available to help treat this debilitating disease. Welcome.
Thank you.
Thank you for having us on.
Appreciate you both for being here. Let me start with you, Dr. Fink. Exactly what is GBM?
Glioblastoma, or GBM, is a tumor that arises in the brain, and it is cancerous. It can cause symptoms similar to a stroke, but those symptoms are usually progressive because it's a tumor. So patients can have right-sided weakness, well, either side, or numbness on one side, or trouble with thinking, speaking, reading, or even personality change. And in rare cases, patients can have a seizure that leads to the diagnosis. Everyone gets an MRI scan these days, and that helps tell how big the tumor is and where is it, and can it be removed. So then the next step is usually surgery.
So let's talk about the treatments. You just mentioned surgery. What other therapies are available?
First treatment, as I said, is maximum safe resection. We don't want the neurosurgeons to hurt the patients for the long term, but we want them to get out as much of the tumor as possible. Then, because there can be residual cells that can infiltrate into the cavity around the tumor removal, we do radiation therapy and chemotherapy with an oral agent called temozolomide. And then once people have gotten through their radiation therapy, some patients choose to use the electronic device known as Optune, which creates tumor treating fields across the scalp and skull that helps to prevent the brain tumor cells from dividing and forming new areas of tumor.
And how does it work?
So it works by being applied to the skull, and then patients keep it on for as much of the day as possible. And the electric arrays create an alternating electrical field, which when the brain tumor cells try to divide, they get disrupted and die. And so that's a different mode of treatment than chemotherapy or radiation therapy, and I think it really adds. The randomized clinical trials did show that patients lived longer when they added Optune to standard medical therapy.
And are there any side effects to using Optune?
Well, when it was used while patients were taking chemotherapy, they had both chemotherapy side effects and the few side effects that can happen from the Optune device. So patients reported some nausea or constipation, and some of them got headaches. And when the device is used just by itself, it's mostly skin irritation to the scalp. So we have ways of treating that, but whenever you wear something all day, every day, there can be some irritation.
So, Janine, you're 41 now. You were diagnosed in your late 30s.
Correct.
Please tell us your story.
So as you mentioned, my life prior to my diagnosis, I describe as work hard, play hard. I was an executive at a nonprofit in D.C. I had a corner office 2 blocks away from the White House. I had traveled to 20 foreign countries and to all but 6 of the U.S. states. And travel was very important to me, and I did it a lot. But I noticed I became symptomatic, and my energy level was decreasing, and I was getting headaches. As you mentioned, migraines were increasing. So my tumor was discovered in my 30s. When I had a seizure. I was actually at a hospital at the time for a doctor appointment. And I went to the ER and I got a scan which revealed a Lyme-sized tumor in the right frontal lobe of my brain. And my family at the time lived in Dallas. We still live here. So I made the decision to relocate to Dallas to get surgery and treatment down there, which is where I got connected to Dr. Fink.
So this is
And this is probably so obvious a question, but this has to have been a really scary diagnosis.
It was shocking. There's really no way to describe it. I just told the nurses and doctors in the ER that I needed, I just didn't want to even face it. So I told them, just drug me up because I just want to sleep through the initial shock, which I did. It did help that my dad just happened to be in town and my best friend, and my mom, of course, got up to DC as quickly as possible. So I had my family around me when I kind of came out of my requested drug-induced coma. So not really a coma, it just made me really sleepy, which was good because I just couldn't handle it. And then as time went on and I got to know more about it and I learned about treatments like Optune, I became more hopeful. And now I live a great life. Like, I'm no longer traumatized. I just try to live my life to its fullest as much as I can. I travel. I spend a lot of time with my family and friends. I'm working again from home, which has been really nice, and something I enjoy doing.
So Optune has obviously worked for you. How often do you use it? Is it something that you work into your day? How long do you keep the device on? What does it feel like?
I don't feel anything. I mean, you can tell that these are like big Band-Aids. So when it's first applied, you can definitely tell that there's something attached to your head. But I don't feel any of the tumor treating, the waves that cause the tumor treating fields. I don't feel those going through. But it's really easy to incorporate in your life. And it has worked for me. Again, I can't say, what's allowed me to surpass, I guess, the average lifespan of a regular GBM patient. I don't know if we can attribute it to the chemo, to the radiation, to the Optune, but I'm just under this I just want to do everything possible. So I think the combination has really helped, and I have not experienced any significant side effects from Optune. A little bit of scalp irritation, what Dr. Fink has helped me with by prescribing a cream, and I wear it as much as possible because that's the most effective. I do have to change it out at least every 3 days, but for me, it's usually every 2 days because you have to shave your head with it, and my hair grows back pretty fast. So when that happens, it can impact the treatment as the follicles kind of push the arrays, which are the Band-Aids, off my head.
So it's obviously allowed you to live a fuller life and to do some of the things that are really important to you. So, Dr. Fink, earlier I mentioned that Janine was having migraine headaches. Are those an indication of a possible diagnosis?
Well, it's important to get a diagnosis for any kind of headache, but migraine headaches are very, very common, and very few patients who suffer from migraine will actually have an underlying brain tumor. But the headache from a brain tumor is more likely to be kind of a constant headache and worse in the morning and gradually getting worse with time, sometimes being associated with nausea. So it's some patients have headaches and some patients don't. But as I said, migraines are very common, and very few migraine sufferers will end up having a brain tumor.
Right. And of course, talking to your doctor about any symptoms or signs of anything that you might be feeling would be important. And Janine, you've shared a lot of information with us about your own personal story, and I want to thank you for that because it's hard to do when you are in the situation, I think. But your willingness to do that is going to help save somebody else's life. Where can people go for more information?
So I usually tell my patients who have newly discovered glioblastoma to look at a website from the American Brain Tumor Association, which is abta.org, and they can learn more information about the Optune device at optune.com, both two good sources.
All right. Thank you both very, very much for joining me.
Thank you, Audrey.
My guests have been Janine Maxson and Dr. Karen Fink. We've been talking about GBM. Informs Empowered. Be sure to check with your doctor or healthcare provider for any additional information.
Want to know the secret to a great night's sleep? It's Purple. Why? Because only Purple mattresses have the Gel Flex Grid. It's the reason why Purple mattresses are soft where you want it, firm where you need it, and instantly respond to movement. The Gel Flex Grid flexes around pressure points to support your whole body no matter how you sleep. Plus, the Gel Flex Grid is 80% air. It breathes, so you're not too hot or too cold. Learn more about Purple mattresses and the Gel Flex Grid at purple.com. Purple, reinventing sleep.
And now it's Geico's Motorcycle Rules of the Road. Before you ride, make sure your mirrors are clean and adjusted properly. And if you're going on a group ride, make sure the lead biker knows where they're going.
Ed, quick question. Where are you taking us?
Oh, I have no idea. Well, am I the leader? Because I was following that dude with the red helmet. Where is he?
And the rule to saving on motorcycle insurance is, in 15 minutes, Geico could save you 15% or more.